Medical surgical nursing is the topic of this edition of the BRG Nurse Executive Podcast. My guest is Dr. Summer Bryant, Senior Managing Consultant at BRG and President of the Academy of Medical Surgical Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Summer, thank you so much for joining us today.
Thank you, Nick. It's great to be with you.
So we're coming out of the pandemic and shifting gears into a post-pandemic era of operations. How has med-surg nursing changed in the last 5 years?
Nurses that are still in the profession and in the specialty have grown by leaps and bounds by what they've faced with the pandemic. Medical surgical nursing is now better understood and potentially more valued as a specialty because they had to turn on a dime and open and close COVID units. And ICUs had to do that as well. But in some of your smaller hospitals, those med-surg units all had to become COVID units. And so expanding their skill set by being able to care for sicker patients and showing the flexibility of them and their ability to learn something new on the fly as we were all learning something new while taking care of between 4 and 6 patients in a lot of cases and helping to train all those contingent workers that came and helped at the beginning. I think it opened a lot of other healthcare eyes. Oh, look what the med-surg nurse does. They really have a lot on their plate, more than maybe what I thought, or it validated, yeah, they work hard and we know they work hard. At AMSN, the Academy of Medical Surgical Nurses, we had the travel agencies coming to us for assistance because they needed help with all of the folks that they were onboarding. They needed help with competencies and educational materials. So that was good to get that legitimacy behind us as an organization. But really, the biggest change is their voices being more heard. And I think that they've expanded their skill set with caring for sicker patients and also with the use of technologies and working with some of their virtual care partners to provide care.
You mentioned a minute ago about greater awareness of the role of the medical surgical nurse. Do you feel until recently that that role has been undervalued?
There's over 600,000 medical surgical nurses in the country, and we only have around 11,000 members. And so it's how can we bridge that gap? And med-surg is not always seen as a specialty. It's just seen where you go if you don't work in the ICU or women's services or pediatrics or whatever other specialty you choose. At the Academy of Medical Surgical Nurses, we've fought that perception. And so we've always tried to work on our brand. And as we've moved forward in the last several years, we've seen our brand validation get better when those travel agencies came to us instead of just going to ANA or another organization to find that education and training for that influx of travelers. That showed us, okay, hey, they understand that we are the voice of medical surgical nursing. It's always a hill we've been climbing, and I think there's a certain level of prestige or a perception of prestige if you're in a specialty other than medical surgical nursing.
You mentioned also earlier that there are new competencies for medical surgical nursing. Can you talk more about that?
Yeah, there's never been a set of competencies just for medical surgical nursing. And so we created them in the last couple of years, and that's one of our big accomplishments throughout the pandemic. We continued to work on these and actually utilized them in the height of the pandemic. But it's a set of competencies for medical surgical nurses. An individual can use them, an organization can use them to evaluate their workforce. But an individual can look and go through the competencies and rate themselves on where they have where they may be an expert in a certain task or area and where they have opportunity to learn. And then when there's those opportunities to learn more or fill in those learning gaps occurs, AMSN's working to provide all of the educational opportunities to build up that competency. And so organizations came to us during the pandemic, to say, I have these folks from the clinic that are going to come help on a COVID unit. How do I know what they can do or not do? And so there's a quick tool that you can use to measure what you're good at, what you're not good at, and what tasks you would be best at doing in a short-term situation, but also long-term. And for example, if you're a medical surgical nurse and you want to go to the ICU someday, what are those competencies that you need to learn now so that you're a better candidate to go do that? We see medical surgical nursing across the career span of a nurse. We're all med-surg nurses when you get right down to it, because that's where you learn how to be a nurse in school. And if you start there in the first couple of years of your career, you take those skills with you to whatever specialty you move on to and however you grow professionally. So those competencies really give the basis to start doing that. And you can really validate wherever you are along your career and kind of fill in those gaps as you go.
You mentioned the term expert earlier. Does this follow Benner's novice to expert model?
That is one part of it. They consulted the Benner model as they were building the competencies. We actually put together a think tank of nursing leaders, and they created the different domains. And then each domain has different tasks and skill sets and other things that build up that domain. It's a validated tool that can be used to measure the clinical expertise from novice to expert of a medical surgical nurse.
You mentioned earlier about some nurses using medical surgical nursing as a stepping stone to a specialty. What percentage of medical surgical nurses do that? And what percentage of medical surgical nurses stay in medical surgical nursing for the bulk of their career?
Oh, I'd love to know the answer to that question, but we don't have data on that to answer that question. Um, a whole lot of people leave med-surg nursing to go to other specialties, which we need them to because we have all those other specialties that are important to patient care. But I've seen plenty of people stay in the profession. I've stayed in medical surgical nursing for most of my career because it was the most interesting to me, and I had the most fun taking care of those kinds of patients. And I'm sure other people feel the same way. But I tried really hard not to be a med-surg nurse for a while. I tried peri-op, I tried some outpatient clinic stuff, and that was really boring. So I came back to med-surg.
And so your specialty within medical surgical nursing, if you will, or your subspecialty was ortho and urology. What got you into that?
That's the first med-surg unit I got hired into. So when I was a new grad, my first job was on a orthopedic ENT urology unit. And so I stayed there for a couple of years. And during that time, we lost urology and ENT because someone recognized that those three surgical services were a little much. And I can't disagree with them. So we got a medicine service, and I think we kept ortho or something else. But then it really started to mix that med surge. And so I stayed on that unit quite a while, and I became like the charge nurse and preceptor and did all of those things. And at some point, that's when I went to go work in peri-op for a while. But then I came back to that unit because it was more interesting, and I realized that I liked that work better than peri-op work. And I had started to work on my master's in organizational leadership, and the opportunity to become a nurse manager on the trauma general surgery unit opened up. And so that's when I moved into a leadership role.
What did you like about that work that made you want to go back?
When I was in nursing school, I knew that I was never going to be a pediatric nurse because they didn't get my jokes. And not that they're good jokes. My dry sense of humor does not work on kids. And I didn't love the ICU because I wanted to talk to people more than I wanted to play with the machines or utilize the machines and more of the science. I like the people aspect more of nursing, maybe so than all of the science. And I just loved the patient population. I love that you can help someone get better for a couple of days after surgery and they go home, or you figure out what's wrong with them from a medicine perspective and get them on the right medications and help them. So I really like that you could tangibly see helping people and moving them on to the next step pretty quickly. And a lot of those adults got my dry sense of humor. Plus, I guess I really like the people that I work with too. And when you really like the people and have a good team that you're working with, it's really easy to stay in a position or a role, even if other things aren't all lined up.
So, what's the secret to that? What sounds like you're describing as a healthy work environment, but what was the secret there that made you want to stay? Because there's a lot of retention issues going on right now across the country in a variety of different units. What made you, and granted, the situations nowadays are a lot different than 5, 10 years ago, but what made you want to stay?
So the coworkers and the patients, like I really liked the kinds of patients that we took care of. But yes, it was a good work environment. We had a good leader who listened to us, and we had good teammates who we all trusted each other. And it's always been important to me to be on a team when I can trust my peers because it makes you feel more comfortable. You can really be your authentic self. And when you're being your authentic self, you provide better care to patients and you're just a happier person. If you have to go to work and pretend for whatever reason, it's not going to be a long lasting, successful story. I would say that the biggest reason for retention, one of the biggest reasons for retention, we always talk about burnout, but I think we've learned to call burnout what it is, which is moral injury. And moral injury is you're continually faced with being potentially under resourced, or you have these complex patients that are harder and harder to take care of, and you've got the resource issues on top of it, or nursing is not always valued as a profession in any specialty. We're seen as a cost instead of a revenue generator. And so that it builds up over time. But when you have to continually provide care to patients and not always 100% give your best, or you're asked to do something that may compete with your values or your morals, you have this moral injury. And I think that's really what contributes to burnout. And we just haven't been able to articulate it that way before.
What would you say is a consistent top issue in medical surgical nursing right now across the country?
I think it's moral injury because I think the pandemic brought to the surface all of the difficulties that we've had. And it's not just moral injury, but it's a risk to their safety. We see these incidents in the news almost every week about healthcare workers being injured or killed because they're just trying to help people. It's a very hard profession when you're working with humans that are suffering, and to keep our mental well-being and our moral injury intact or decreased, you want a safe work environment. And so if we don't have a safe work environment, all of those other problems happen where you have turnover and people leaving the profession and nurses that leave quickly. As long as that's happening, I think we're gonna continue to have retention problems.
Can you talk a little bit more about the Academy of Medical Surgical Nursing?
It's the only organization dedicated to the specialty of medical surgical nursing. We're an affiliate of the ANA, and we've been in business for over 30 years. We have a certification for the CMSRN as a certified medical surgical nurse. And we work closely with our medical surgical nursing certification board to provide the education for those folks that would sit for that certification. The PRISM Award is an award we give to individual units that exemplify a positive work environment and can articulate all of the things that they're doing in an application process. I think one of the other things that's great about AMSN is that we have a free student membership. So anyone that's in nursing school, we provide them a free membership so they can see what an organization like AMSN's about and start learning about professional organizations because they can have access to all of our educational materials as well. So we really want to help create the next generation of med-surg nurses and just nurses in general.
You're coming to the end of a 2-year presidency leading the organization. Looking back on the past 2 years, what are you most proud of?
Not many people get the opportunity to serve in a role like this. And it is one of the highlights of my career because I have gotten to meet so many people and hope to be a voice for a group of nurses that may not always have the loudest voice. But really, being president through a pandemic is a very unique experience that hopefully no one else will have to have. But I'm proud that we quickly pivoted a couple of times. Overall, I guess I'm just most proud of learning along the way that work can be done differently, but it's still effective.
What are the key issues that the Academy of Medical Surgical Nursing will be focused on in 2023 and beyond?
We are really continuing to work on expanding our membership and increase our membership numbers, supporting med-surg nurses' well-being as well, and helping them deal with moral injury and burnout and finding their way and supporting them on their career path, whether it's staying in med-surg or going on to something else. And then we just want to keep gaining legitimacy as a specialty and building our brand so that we can support more and more members.
You were recently featured in OR Today, and in that article, you discussed your enjoyment in and desire for others to have greater ability to see the big picture. What does that look like for the med-surg nurse, and how do we do that as nurse executives?
I think having leaders who understand the big picture is really important in med-surg nursing and nursing as a whole. We have to, as leaders, understand the big picture ourselves and be able to see it and navigate the policies and issues that come at us. And we can help them get more involved by asking them how they feel about a certain topic or getting their input when we want to make a change or bring a new product into the system. Getting the nurse's voice in the conversation at all levels is very important. And that is the way that we grow as a profession and we grow to respect all of our specialties and what they bring. And the more that nurses are involved in the interprofessional team and understand the cross pollination among specialties, whether it be the medicine side of things with physicians and providers, or the case management side and understanding how the length of stay affects all of us, but how the nurses that are caring for patients impact length of stay or patient quality and patient experience scores. All of those things really matter. And it's very important for nurses to understand their role in healthcare and how they impact the patient in that bed.
What's the one thing you think nurse executives that do not have or have not had a med-surg background that have gone right into a specialty and have moved through that specialty into leadership positions and are now leading a large organization that includes medical surgical nurses? What's the one thing you think that they need to consider or be mindful of when dealing with med-surg nursing issues?
So I think medical surgical nursing in a clump is one thing, but as an executive, if I wouldn't have had that much of experience with it, there's so many subspecialties within it because you can be certified in orthopedics, you can be certified in urology, trauma. So there's so many different avenues that you can go in med-surg nursing itself, but understanding the big picture that a med-surg nurse can take care of all of those kinds of patients, not just ortho patients or not just a medicine patient. There's really a skill set to take care of a variety of patients, and that the med-surg nurse is really key in care transitions and getting all of those pieces and parts together, making sure that the patient has physical therapy to improve mobility or making sure that social work's involved for whatever reason to help that patient progress towards discharge.
Any closing thoughts?
Almost every patient in a hospital is on a med-surg unit at some point in their hospitalization. So those nurses see the vast majority of patients moving through the continuum of care, and those nurses need the resources and the time to take care of those patients to the best of their ability to move them through the system. And I think that's just something that gets lost sometimes and that people don't always think about, leaders don't always think about. The vast majority of my patients are medical surgical patients in the hospital, but so maybe I need to have more face time with that group to see what their needs are rather than focusing where patients are only for a short period of time.
Great. Thank you so much, Summer. I appreciate you taking the time to talk with us today about medical surgical nursing across the country.
Thank you. It's been a pleasure.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.